The outbreak of COVID-19 triggered the largest human virus war in this century. We share the care experience of CCH Medical ICU and providing a safe environment for patients and staff. In units with negative pressure isolation rooms, every staff must complete the training of putting on and taking off PPE. Everyone must pass the test. We practice putting on and taking off PPE and contagion collection and transport at usual time before endemic disease outbreak. Nurses are divided into two care teams. Staff members are divided to half meals to reduce the risk of infection. Check the storage of PPE every day. Place workers in each end room of the isolation room for easy access to staff. Post the process of putting on and taking off PPE in the entrance and put a mirror for staff to check the PPE are correctly weared. The specimen collection process is positive in the entrance and the ward for staff. Make specimen collection box and place in the ward and the entrance to avoid cross-infection. Use two-way intercom to reduce poor communication. Monitor the pressure of the negative pressure room every duty shift. Preventively wrap the monitor wires in a plastic bag and change new bags for next patient. Design a list of supplies and prepare proper seating before the patient enters. Because all waste is infectious, replace a larger infectious trash can to avoid frequently overfill. All waste are regarded as infectious waste. Before the patient enters the ward, place the pad with bleach in the entrance and outside the isolation room to minimize contamination. Before the patient enters the ward or ICU, all routes are controlled by guards to prevent personnel infection. The guards control the elevators and accompany them to the ward or ICU. Directly enter the isolation room guided by the nurse leader to reduce exposure time. Before entering the isolation room, all staff check the PPE are properly worn. The timing of wearing the one-piece PPE is to perform invasive treatment or collect respiratory tract samples. If there are colleagues in other categories will enter the isolation room, must remind again. When a patient who is expired and positive or unknown result discharged from the hospital, the guards control all exits and immediately set to the remains to the crematorium. The driver should wear PPE throughout the course. After a patient who is positive discharged from the hospital, the cleaner must put the infectious materials into the infectious garbage bag. Next, the nurse takes the sterile lamp into the ward with PPE. Control the power switch outside the room to make the sterile lamp work. After sterilization, the cleaner will the PPE to the ward cleaning. Be strong and courageous. Do not be afraid. Do not be discouraged. For the Lord your God will be with you wherever you go.